What I want to do is see how we can get all of you to ask questions. And I have some questions that were sent in to me as well. I want this to be fun for all of us and to really just to share our successes and how this site has allowed our practice to grow. And tonight we're just going to talk about really what happened in the last 2 weeks, really how I've been using this site for the last several years to build our practice, but just in the last 2 weeks, just some great examples. So I'm gonna do my best as a new format. We're using another webinar thing that kind of just kept having glitches, so we're gonna continue to go along with this. So first off, I hope you're all having a great night. I hope you had a great day. And I hope you find this fun. And I want you all to get involved, and I wanna see if I can figure out how I can really look to see who's on here and see if I can see your faces, and to ask questions. So I just want to give you a quick exploration of how I use this on a daily basis. I'm not going to talk about how I use this to educate patients. There's webinars up there, and I plan on doing these more often. I want to do more of these. I want to add more of this to the community, to the premium and gold members, so that we can continue to build our practice and keep this moving. So I want to show you, just in the last few weeks, we use this site to educate another medical provider in our community, and not educate them on the injuries, but educate them on what we know in our office and what we can do for them. So there is if you guys have any questions, there's a little Q&A thing down the bottom you can click to ask whatever questions. So we went to this doc who is a surgeon, and we had our computer with us. We got online, and basically what we did, and what we've always done, is really start to hit our community. And everybody goes after the attorneys, right? Everyone is looking for PI and looking for attorneys. Who do you think sees more auto than attorneys? People like us, people like you, people like other providers. So we just wanted to get out and meet some providers. So what we did is we went to dinner. We're like, hey, let's go to dinner. This is what we do. And we sat down with this surgeon. And this surgeon had no idea that we could do the things that they're trying to accomplish, because they get chiropractors that are referring to them, and there's really not much that they see in their notes or really understand what it is that we can do. So I'm going to show you, I'm going to share my screen, and I'm going to show you just a little bit of what we did. And this netted 10 new patients, and actually a little more than 10 new patients in 2 weeks. And 2 weeks for us is 8 days, because we work 4 days a week. And we built this amazing relationship. And how we did this is we sat down, they were talking about vascular flow, and they were talking about headaches and pressure in the brain. And we're like, well, you know, there's some studies, and I'll show you what we did. And we just had this right here. And let's hope that this works here. Maybe we need to share this one. Let's see if this works. Hopefully this does. So we basically just went to professionally integrate. I'm gonna check my phone here because Anna is on the line. I wanna make sure that this is working for you to see. Okay, perfect. And we just looked for something like, okay, what is it that you do? Well, I'm a surgeon. We see some vascular stuff and pressure in the head. We're like, oh, and luckily, you know, we did this study, but it's all right here for you. And we were like, oh, well, you know, people that get hurt in crashes. And we showed them this, like, when you know, people that get hurt in crashes or trauma, there's a study right here that actually shows that car crashes and trauma changes blood velocity. And take a look at this. This was published in this journal here, and he'll take a look at it and we'll be like, so tell me what you think of this, because look at what they're saying here. Cervical injury, during a cervical injury, cervical receptors also send reflexive stimuli through the spinal cervical reflex, which results in turning off of the body in space on its axis. And he's like, yeah. And I'm like, well, you see a lot of blood flow and changes in blood flow. But we also know that in trauma, which most likely the patients you're seeing have something like that, can affect their joints. So you could be looking at some of the vascular, we could be looking at some of the joints, and this is something that we do, and we just have this right at our fingertips. Like, yeah, check this out. And we're like, yeah, look at what this study shows. Look at what happens within 6 months after a trauma. It really changes some problems. So what we do is really look at certain aspects of their spine. For instance, a loss of curve has been shown to be a real problem, and you're a surgeon. And here's some studies, and I don't care what I pick. I try to make this as easy for myself, which should be making this as easy for you to just pull up and be like, yeah, you know what, check this out. I'm sure you're aware of this. Here's a study that was published in Journal of Neurosurgery. And what they did was they knew that a patient had a loss of curve, which can also affect the vasculature. And in order to fix the curve, these surgeons are doing fusion. Have you seen this? I know you're a surgeon. Oh yeah, well, you know, the reason they're doing this is because worsening of the sagittal parameters associated with decreased health-related quality of life. So we know in our office, we look at curves like this. We're gonna measure these curves, and we're gonna try to do this for the same outcome as a surgeon, but maybe we can work together. And he's like, I didn't know it. Literally, he's like, I had no idea you guys can do this. And then we went to other factors, whatever it is. Let's say you're talking to a surgeon about a disc. Just go to disc. You don't even have to look at the site before you get in, because I try to make it easy. It's like, oh, well, you look at discs. Well, you know, here's a study. And even if you're not familiar with it right away, here's a study that I want to show you that just talks about, you know, the nucleus pulposus, the annulus fibrosus, and how all of these really need normal movement. Look, if there's a increased compressive loading, increases pressure onto the disc. Well, what we do is we look to see where those compressive loads are, and we try to minimize those in our office. That's what we do. And if for some reason we really can't help them, tell me a little bit about what you do. So we just sat down, and we do this, whether it's a medical doctor, a dentist, a surgeon, a primary care, oh, you know, and then find whatever it is that you're looking for. Oh, you want to talk about, I don't know, headaches. I try to make it as easy as a toolbar here for you, for patients, to show them. It's like, okay, headaches. Hey, you know, check this out. You have patients that have headaches a lot after trauma. Well, have you ever checked them for alar ligaments? And I just pull this right up. Oh, well, look at what happens here. You know, they were talking about this back in 1990, that alar ligaments get damaged in whiplash groups. We see this all the time. We can help try to stabilize this with co-managing with you so that we can try to give them a biomechanical correction. So hopefully we can fix them before they need a significant surgery, or maybe we can lessen the type of surgery you need to do. And if you think that the surgeons are going to feel that you're taking away business, you don't know these surgeons. They're more than busy, and working together is a happy patient gets more referrals from the patient and from the provider. So this was a great way that we just 2 weeks ago, we sat down with this doc, and like I said, it was like, I don't know, like 9 or 10, 12 patients, whatever it was, in 8 days. And for weird stuff too, like not for neck pain, but for, you know, for CSF leaks, for increased pressure in the head, because we just sat down and we're like, oh yeah, check this out. You know, and he talked about instability. Oh, you know, with the skull base and instability, we're like, oh, you know, we look for instability all the time. And here's why. I mean, as you know, as a surgeon dealing with this area, I mean, here's a study where they look at the upper cervical spine and the myodural bridge and how this tissue attaches to the cord. What do you see in surgery? And, you know, when we see patients with all these suboccipital spasms, we're wondering why. And then we want to look at what's happening at that myodural bridge, just like this, you know, this surgical paper talks about that they published in 2019. We can correct this. We can help your patients with this, so hopefully they don't need to get their skull fused. And if we try and we identify if they have this pathology and they don't get better, then maybe, you know, maybe there's another option that you have to offer them that we can work together. And it just works, because it's just like if they came to your office and like, hey, we see these pathologies. Do you have an answer for this before they need significant, you know, what do you have to offer? And you just start working together. So this is one way we really use to get into increasing our knowledge base by showing them what it is that we can do and why. And the site, I mean, look, docs, all you're on here, I hope you're using the site every day, right? Use it in the same way for a patient. Oh, hey, Mary, come here. You got suboccipital headaches. Check out this study. Look at the anatomy that's attached right here. And then I'll just do this, copy image, put it in her notes. We talked about this with the reference. Hey, look at what happens. You see how delicate this structure is? This is your spinal cord and your brainstem. Look at this tissue where you have pain and headaches, right? But we use it from the doctor perspective. We're hitting more doctors than attorneys with it to kind of show what it is that we're trying to accomplish and how we can accomplish this. So it's looking at how can we improve, how can we improve this to get to get doctors to understand what we do, right? And what chiropractic means in our office. So I'm going to try to switch the screen here if I have to. I think I have to stop my share to go back to this one screen. And I just want to see if there's any Q&As yet. No questions. Okay. So I can continue going on with that to use this to increase your exposure to other providers, and using this not to say, hey, I'm a chiropractor in your office. Most of these docs have had chiropractors refer to them for 15, 20 years. But what we're doing is we're showing them, oops, I don't know what that button is there, is we're showing them what it is that we can do and what the science says we should be able to do. You have a doc that's like, yeah, you know, we see facets or discs. Just like, oh yeah, you see facets? Well, check this out. You know, so do we. And look, did you know, like, this is what's crazy. This is what's so complicated with some of these patients, right? Here's a really cool study where they showed that when they looked at the nerves on the ends of their fingers, in the control group to the chronic whiplash group, the nerves actually change. So we know that there's increased sensitization. Our goal in our office is to try to minimize that sensitization by improving the overall health. And we do this just by improving the joint mechanics, minimizing the pressure on the joints to try to get them healthy. And we put this right in our notes right there for you. So this is just one way we use it. I'm going to go back to here. I think there may have been a question. Trying to get in with MDs has been exceedingly hard during the COVID panic. Was this a relationship from before we basically shut out? So I'm going to answer this live. So one of the questions was, we're trying to get in with MDs has been exceedingly hard during the COVID panic. Was this a relationship from before? This is a brand new relationship. You know, everything right now is a little weird. And the beauty is, don't be afraid to, if you can't get into their office because of COVID, I mean, Zoom is, I mean, this isn't free because we have people on here, but you can get Zoom for free and be like, hey, I want to send you a Zoom link. I'm going to order you, and look, I'm going to order you lunch. I want to show you what it is that we do. And more importantly, instead of saying, I want to show you what we do, I want to know what you do, right? I want you to tell me what you do. So when I have the appropriate patient, I know when to send over to you. But in the interim, when you tell me what that good patient is, I want to show you what we can offer that patient. I want to show you why we can offer that patient. And it's all on the site for starting at $100, you know? Anonymous, let's see, I'm going to answer this live. How long did it take you to develop the lasting relationships you have with certain lawyers and doctors that give you the high level of credibility you have with new doctors and lawyers you meet? How much can professionally integrated cut down on that time? You know, every relationship takes time, right? This one was new, and we've gotten more new patients from him in 2 weeks, 3 weeks than really any doc. But I think it's because he's never had a chiropractor really talk to him or show him what we can do. So every relationship takes time, and it's just reaching out. It's if you see a patient of theirs, make sure you send them the initial evaluation. Let them see what is happening. Let them see what your notes show. And you know, if you're worried about your notes, again, premium members, send me your initial. Let's see if we can make it better. And gold and premium, there's webinars on here about making good notes. And professionally integrated, I think it cuts it all down, because what you're doing, and I'm going to get to the lawyer question, is you're showing them what your knowledge is and what you have at your fingertips, right? This isn't necessarily professionally integrated's site. Make it your own, right? Like, it's professionally integrated, but look, if I just do this, right? If I just do this and someone says like, okay, I send you a Zoom link, whatever, and you're a doc or an attorney, and I'm going to get to the story of the attorney this week, and you send them some lunch and you're like, hey, I want to see what you do. I'm going to send you a Zoom link, want to meet you, whether it's new, you're just introducing yourself. And sure, it's hard to get in, because it's hard to get in my office too, because we're busy. Right? It becomes a time thing. But if you can start to send them a patient, ask them for their cards, and then talk to them. And let's say, doc, you can't get into the doctor's office, but maybe you could do a quick Zoom call. And then you use this site as yours. Like, hey, doc, again, you know, you mentioned you see a lot of instability. Man, those are really challenging. Tell me what you do. And yeah, what we know is that it is really challenging. Just pick something, right? Like I have so much stuff. Like I don't care if you go to page 3, page 5, you don't have to necessarily remember everything. You want to go over it and be like, yeah, check this out. I try to put the headlines in there for you to see. So you can be like, yeah, look, here's from Journal of Neurosurgery. And look what it talks about. Dynamic elements can magnify the static components of canal deformation. We know this. We are aware of this. And the reason that we're aware of this is because this is what I show my patients. This is what I put in my notes. This is what I keep myself up to date on with the research. I want to know why instability is a problem. I want to know if they have instability. I want to know that if there is damage, it can cause a damage to the spinal cord, according to Journal of Neurosurgery, and let's say it's a neurosurgeon. So we're really careful to, one, identify that, to give an appropriate diagnosis, to educate the patient of what that means. And then you start to build that relationship right away. And when you use this in the same way, whether it's a patient, hey, Chuck, we just diagnosed you with instability. Well, check it out. Look what can happen here. And then you just put it right here, copy, boom, drop it in their notes. Copy, here's the other thing too. Let's say you spoke to this medical doctor and you went over 2 of these studies. Hey doc, tell you what I'm gonna do. I'm gonna send you this really quick. Copy, paste, put it on your heading. After the call is done or the thing is finished, send it out with your heading on it. Hey, it was awesome talking to you. I know I discussed some of the research that I'm sure you're familiar with. I just wanted to send some of it over and why we're so cautious to look at these and to identify them and give them an appropriate diagnosis. Copy, post, put out, and you're done. Right? You're done with showing them what it is that you know. So I think it cuts the time back so much by understanding and having it at our fingertips. The other thing, and very similar, last week, I think it was Thursday, this was a great marketing thing that I did. And I've done this before, but this one just went fantastic. So you want to get in the door with let's say attorneys. So pick a patient that you have and look to see who the attorney is, right? Let's say the attorney is Marcia and you haven't really talked to Marcia. Call Marcia and say, hey Marcia, this is Dr. Katz. I'm treating Dan and you're representing Dan. And I just want to go over with you really quickly what Dan's pathologies are. I've already put this in my notes, but I just kind of want to go over it with you, right? So, because again, if you're on professionally integrated, you should be putting some of this stuff in your notes to pepper it, to have in there. But then what we did is we did a Zoom call and it was during lunch. I didn't charge her for it at all. The patient was incredibly grateful. And I said, hey, Marcia, I just want to go over you. So we diagnosed, let's say, Jessie with reversal of cervical curve, she had instability, she had disc pathology, whatever it is. And I said, first, I want to know what questions do you have? And the attorney's like, yeah, one of the questions, and it's interesting, this is a case that happened in Texas where, I hear patients in Texas like, oh, you'll never get verdicts like that. And already the first offer was 150 grand, no surgeries. And basically the attorney was like, I read your notes. And I said, okay, well, what questions do you have? She's like, well, the one question is, how long is she going to need care? And I was like, awesome, great question. Let me show you. And I just came up to professionally integrated. And again, I was sharing my screen and I was like, let me look at, let me look at chronic, right? And I was like, all right, let me see what I put down here for chronic. And I was like, okay, here's some stuff that just quickly popped up. So I was like, well, let me look at some stuff. I was like, well, let me show you something. So, and I was just sharing my screen. I was like, look, here's a study out of pain population, European Journal of Pain. And they actually show that patients involved in crashes have significantly more chronic pain than those that aren't. This is out of 12,000 people. So one, we know that patients that are in car crashes have a lot more widespread pain. One explanation is central sensitization. It's actually a nervous system injury. And they also found that 96% of individuals out of 12,000 patients reported additional causes for pain, and individuals with WOD also reported pain in a wide range of bodily areas. So Marcia, what this means is Jesse, who was in the crash, according to this study in European Journal of Pain, has a 96% higher likelihood of having chronic pain all over her body. And that's going to last most likely the rest of her life. Now, the chiropractic care that we're doing, as our notes show, is really helping her. So to say that she's going to be better in 3 months, we can't. What we can say is she's more likely to have some chronicity and long-term issues. Now, we also diagnosed Jesse, I think was the name I used, with a loss of curve. And I want to show you some stuff that happens with a loss of curve. One, her neck will fail quicker. She's more likely to have flare-ups. Her neck is going to get tighter. And everything I put in here that I put highlight for you to copy and paste your notes, I try to make it so you can just read it and it's going to mean something, right? So even if you're like, I don't know exactly what this says, you can read this. Oh, look, it says time to failure for all specimens. And there was a statistically significant difference in the time to failure between the two cervical spine postures. An abnormal curve failed quicker than a normal curve. The crash caused this abnormal curve, so she's more likely to break down. And as you can see, this is what it shows in the surgical journal. So our goal is to get her here, but unfortunately this crash got her here. So this is going to be a long-term thing. And then we just started talking about these injuries and she was like, oh, and I was like, yeah, you know, we also diagnosed her with instability and she had upper cervical instability. And, you know, there's a lot when it comes to instability that this could be chronic for the rest of her life. And not only can it be for the rest of her life, and then I'll just scroll down, you know, I'll pick, I don't know, let me go to page 2. And I'm just talking to her, you know, explaining why this may be a really long-term problem, why this could lead to degeneration, like this one up here shows, or why this can be a real problem, and why ligament injury healing does not heal to 100%. And here's what this study shows. And I just showed her these pictures, and she's just taking notes, Before we got off, it went from, all right, they already got offered, I think it was like 140, 150 grand, to, hey, thanks for this, to, can we pay you $1,200 to write a narrative just to put this all in one thing? And she's like, I don't know. And she literally said, I don't know why we don't send you more clients. So I'm like, I don't know, but you certainly can. That's how I use this site every day. I don't care if it's an attorney. I don't care if it's a doctor. I don't care if it's a patient. I'm going to educate them on what I know. I might pick one of these a day for a patient. Like, oh, let me pick a good pathology. You know, I saw a bunch of instabilities, and I'm looking at the schedule, and a lot of these patients have instability. Let me just kind of pick something here that might look like something that's going to be really interesting to talk about with the patient for this week. And I'm going to be like, this one's cool. This one actually shows that instability and a loss of curve will cause their bones to degenerate. And I just show them this. Hey, check this out. I might take a couple paragraphs and print it up with my heading on it, hand it to them when they come out. Boom. They're going to go home, show it to their family. But use it to educate the providers. Go talk to dentists, right? Dentists, two things. One, their necks are destroyed, right? You should be seeing dentists because they're constantly looking down on one side, head rotated, hygienists as well. So you can get in and talk to them about why you want to help them. But then they see jaw problems. They don't know what you can do. So we just go in here, type in TMD, reach out to a dentist. They see jaw stuff all the time. Oh, look, here's TMD and whiplash and how the jaw, most likely it's affected, the jaw is being affected by the cervical spine. You see someone with a jaw problem, you know, a lot of this is from the jaw. Here's the whole paper. A lot of it is actually from the neck. You know, so I'd like to, you know, if you see patients that you're looking at their jaw complaining, give us a call. Yeah, here's a study on a journal of dental research. You know, we keep up to date on all of this. Let me show you what I have. There you go. We're going to see what some of these questions are here. Let's see, I'm going to answer this. Will getting involved with you and professionally integrated help connecting with other doctors from other health disciplines that validate these findings about the importance of spinal alignment? So I'll answer that first. That's a really good question. It will. We get calls from all over, mainly because of our DMX and some of the stuff that we've done, and then they try to find a doc near them. And I'm putting together now, Anna, who's on this right now, who is wonderful and a huge asset to me, so I hope you're listening, Anna. And we had a big meeting the other day of changes that we're doing. And one, we're going to do a, we're going to have a demographics if docs want us to have of where they are. Okay, where's their office? So when I have a patient that calls, they're going to get there and they're from out of town. We're going to send them to a professionally integrated doc that has this information. Two, I can't say yet because nothing is set up, but I am in talks with a really huge medical clinic that they have offices all over the country, and they love professionally integrated, and they need this information, and they need docs to work with their docs. So the goal is the first step is to get patients just out to professionally integrated docs, which I know I've referred to a lot of professionally integrated docs if I have someone going in your area. But now we're going to make it easier where I can just see where everyone is, and we can find a professionally integrated doc. And then the second phase of this, which we've already had a couple meetings with these large medical clinics, is they want professionally integrated docs. They want docs that understand this, and they want docs so that when their MDs refer out, they know that it's going to professionally integrated. And then they need to be associated with the site as well. Will I be able to refer to these doctors for confirmation of findings and possible treatment to make sure my patients get the right care? I mean, that's the whole point of having all this information, is to have all this right here. Right here. I'm going to try to stop sharing so I can see if this is working. Something else popped up here. I'm not sure. It's on. So I hope that this was, somewhat effective. I hope this was helpful, but this is how I use it. This is how we built our site. This is how we built connections. Stop. Like we're all, I feel with this site, you're all just a couple of steps away from being crazy busy and crazy successful. The information is right here. One of my friends who's a chiropractor who's on here, he's like, dude, the problem is if I try to sell you a new Mercedes for $100, you wouldn't buy it because you think there's a problem. You're charging too little. I have a practice. This isn't my main gig. I know there's marketing agencies out there that are going to charge you $30,000 for a program. Look, this is constantly evolving. Hop on it and use it, but it's only going to work if you use it. It's how I build my practice, right? You have the same access that I do and the same information. So use it. If you can't get your money back at even just at the $100, then we really need to talk. And I'm going to do more of these. I want you all to use this. This information is here for public health, right? Look at what we can do. Look how we can help these patients. We can help in ways that other professions just can't. And one of those ways is to really understand what it is that we're doing and why these patients are having pain and having problems, and letting the providers in your community know what you know, right? What you know, and you have access to all of this right here. Oh, hold on, I think there was one more question, sorry. I know I asked on Facebook, but can you quickly reiterate the guidelines for referring DMX? And are you okay with discussing cost? Yeah, absolutely. So we have a DMX in Colorado. I don't own DMXs or DMX companies or anything like that. So here's what I do for when I refer for digital motion X-ray. And we're going to refer every patient for a DMX. Well, one, the paper that we just did, let me share this. Let me talk about this first and I'll share. One, when do I do a DMX? If a patient was in a trauma, and they're having a hard time holding up their head, like positive Russ sign. They have dizziness with movement or nausea. I may do the DMX right away. If they're in a crash and they have suboccipital headaches or trauma, I don't care if it's a car crash trauma, I treat everyone the same, whether it's they fell off their bike or whatever, and they have problems and they've been really suffering. And maybe we took a regular X-ray and we see that they have a loss of curve, and maybe we see that there's AOMSI in a couple of the segments. We'll start to treat conservatively. We'll see if we can get them better. If they're not getting better, especially after 6 weeks, the research paper that we did that is now the new gold standard is you DMX them. We're looking at 37 parameters that you just can't get on a regular flexion extension film or just static movement. You want to see all these other movement patterns. So that's when we'll do it. A lot of times we'll get referrals from other docs and it's not us making that call. Like they're not responding. Maybe they have intracranial pressure. Maybe their dizziness, movement, bumps really hurt them, you want to rule in or rule out instability, and then we'll do the DMX right away. What we charge $975 for insurance, right? Whether it's like PIP or a lien, we charge the exact same amount. And that comes with a full biomechanical report that I do. And then with that, you get the paper that I wrote. So that holds a little more weight compared to a regular DMX. Sorry for the people that have DMXs, but, and then if they pay up front, we give them a 20% discount. So it's $780. And that's what we do. But again, it's all, there isn't a, it's like on all these injuries or treatments, it's not just a cookie cutter. And I know that's not what you're asking, but it's a case-by-case basis. You know, like, man, this patient's been suffering for like 6 months, 10 years, and they've had all these other images. And we see some stuff, but I don't think that's what it is. I think there's more. Then we're going to do a DMX. If they were involved in a significant trauma and they're coming in and they're having real significant pain, like I had a guy come in today. I don't have it. I put his image up there. We're like a stack like this from Mayo Clinic, Columbia University, and they never even did a flexion extension image. And I was like, you know what, I'm not even gonna start that. They did all sorts of stuff. I'm like, we're gonna, before I treat you, we need to do a DMX. You've been hurting for, I think it was like 6 years. Did a DMX on him before we'd even do an initial exam. I'm like, look, man, everyone else has done everything on you except this. And we found something that kind of correlates after speaking with them on a consult. So it's feeling it out. Hey man, I've been treating you for 6 weeks after this crash and you still have neck pain. Now, you may be able to use the site and say, hey, neck pain can last a long time. But we also don't know if they have neck pain from another pathology that you can't identify. And that's the paper that we did. And this is right here, not this one, that one's 14 minutes long, sorry, this one, where I did a Q&A, and I talked all about this right here, where you can, you'll see here where I go over the paper and break it down, when we do the DMXs, how long does it take, you should do it, so on and so forth. And then break down the paper of when you should do it. And this paper here talks about after 6 weeks, if they still have pain, you need to do a DMX. And then that just covers you, where you just put this right in your notes. Hey, they still have problems. We need to do a DMX. So that's just kind of how we use this to, one, connect docs with good providers, let providers in your area know how you're different, show them, look, man, I've got all this information at my fingertips and I'm going to put it in my notes for you. And I want to show you that we're looking for these things. It's as easy as that. Nothing's easy, right? We still got work to do. But this is what we're doing, and this is how we use this site. Log on to professionallyintegrated.com, and it's all right here. I'm just trying to make it super easy for you guys, and I want you all to share in the same type of success that we have with using this site. So yeah, I don't know if anyone else has any further questions. I think I asked those, and if anyone else, if you have more questions, let me know. I don't know if it's easier to just let people talk. I don't know, Anna, if that's easier, if anyone wants to talk or if anyone has any further questions, but I just wanted to go over this, kind of keep it simple, keep it quick. We have a few webinars that are coming up that are gonna be really exciting. We have some that are in the works that are gonna be crazy exciting. I'm just trying to give all this back. I want you all to use it, but the site is a waste of money, just like your care, if it's not used. It's got to be used. Let's see here. Hold on one sec. Well, thank you. Used professionally just this past week, meeting with an attorney. Awesome. That's what we want. And I appreciate you too. And I hope you used it. I hope it was beneficial. Like, just keep using it. It's all, I've got a bunch more research that's coming up that I'm going to put on there. I've got some, and some of them, if you notice, aren't even car crash stuff. It's just patient stuff. I have one that I'm going to put up there, a study on back pain of people that live in Tanzania and what they correlated to. It's super cool. And we can translate that to the next patient that comes in with low back pain. Hey, check out what they found. So I have another one that I'm going to put up that's really complicated. And it's like necks, and they compare it to woodpeckers' necks. and why woodpeckers don't get their necks jacked up. Like, that's cool stuff that we can use to explain to people in our community. So I don't want to hold you all up. I hope you found that super, I hope you found it helpful. And I hope when you go into the practice tomorrow or Thursday or Friday, whenever you work, you start using it more, right? Look at all the ways. Go to, and I just want to show this really quickly. Just go to this opening page, how to use professionally integrated, and just watch these, right? I show how to do a search, and they're like 2-3 minutes long. How to educate your patients, just quick little tips, and just pick one thing. You know what? I'm going to focus this week on internal marketing. How can I use the site to make newsletters? How can I make it to make little things to hand out to my patients? How can I use it to send little tidbits to their primary care physician? Then I'm going to look to see how can I use the site for just attorney presentation? How can I use a site for patient education? And slowly chip away. You're never going to catch up. There's 300-400 posts on here, and every week there's another one. You're never going to catch up. That's my goal. We'll never catch up because of how much information is out there, and new stuff keeps coming up every day. So how do I get in touch with the surgeons? Man, you got to call them. You know, look, you got to remember, so someone just asked, how do I get in touch with the surgeons? You got to remember, surgeons are, the last year I've really come to like know some as friends, and look, man, their jobs are stressful, but it's also their business. If you think that they're just sitting back, referrals are flowing in, kinda, but they also have major overhead, and they need to build relationships in the community. I think one of the biggest mistakes we make, because it happens to me, in my office, we've been here 19 years, putting in so much energy to build it up, and then someone comes in that I don't know, and they're like, hi, I'm an acupuncturist that I'm opening up down the street. Here's my cards if you want to give to your patients. Now, maybe I'm a dick, and I'm like, so let me get this straight. I just put in all this effort to build up. You don't even say, let me get your cards, and you're like, give out my cards. I don't want to do that when I go into surgeons. What I want to do is like, hey, let me have your cards. And before I take your cards, can you tell me what it is that you look for? What do you like to do? And they're going to be like, oh, well, we like this. Okay, well, hey, I'd love to talk to you a little bit about what it is that you do. And I want to talk to you about some of the patients that I see of when, you know, we may be able to get to you. And I'm sure not all the patients that you have are surgical either. So what do you do with those? And I asked, only like 5 to 10% of the patients they get are surgical, which means 90 to 95 might be able to come to your office. But show them, what, hey, I totally get it. You know, perfect opportunity. You're a surgeon. You know what? Totally, you know, completely understand what it is that you guys do, or not completely, but you know, there's some really cool studies. Hey, look, here's one with fusions. You know, just pull up stuff. Yeah, no, hey, look, I saw this in Journal of Medicine. They talk about how a loss of curve can increase disc herniation and eventually surgery. Well, you know, we can fix this. You know, so patients that aren't surgical yet, go ahead and give them, you know, we'd love to be able to see if we can help keep them out. But also we see stuff where it could become a problem. Oh, look, spinal kyphosis can lead to demyelination. We totally understand this. And this is why we want to get to them correctly before they need surgery. But if they get to that point where there's a bone spur that's hitting their cord, maybe they need surgery. Do you do that type of surgery? Yes, I do. Cool. Can you tell me a little more about that? Maybe we could set up a lunch. And you bring the computer with you, you get on Wi-Fi, and you show them why what they do is important. Because look, if we go in there thinking that all surgeons suck, they're not, like, there's a time and a place, man, right? This person has complete cord compression, and you might see that. But they may see someone that, like, their primary care, x-ray, they're like, whoa, your neck looks terrible. They send to a surgeon. They don't send to anyone else. They send to a surgeon first. The surgeon then looks at it and says, yeah, your neck is messed up, but you're not surgical yet. So just wait. But you educate that provider that there's someone like you that might be able to keep them out of the surgery room. That's how we get in. You know, and not all of them are receptive. I'm not going to sit here and lie to you and be like, I've got 100% success rate with getting in, or 100% success rate that they all like what I have to say. Some of them don't. Some of them want, like, look, I just want to do cortisone and a little bit of PT. And that's their paradigm. but you get in with the right ones, just like if they get in with you, it's an amazing relationship that you form because everybody's happy. The patient's super stoked, you're psyched, and the other provider, whoever it may be, is stoked as well. But they see what you're doing is different. At least that's what we try to do, and we show, and it's all based. Like my whole, if you ever just walk into my office and you come into my treatment room, and anytime, Professionally Integrated will be up on my screen. Hey, I want to show you guys something. It just, like you walk into my office as a patient and it just looks like this. It's on something, whatever it may be. Oh, check it out. Oh yeah, you see that Spinal? It takes 3 seconds to explain that. Boom. Yeah, that's why you're here. We want to try to help this. And then you talk to their primary care. Yeah, hey, they have spinal kyphosis. And here's another huge tip. I talked about this before. Every patient that comes in your office, you should be asking who their primary care is. And it should be on your paperwork, whoever any of their providers are. Look to see who it is. Send them your initial with stuff around a Professionally Integrated in it. They're going to look at your notes and be like, damn, no other chiropractor has sent me this before. And then with that letter, ask for their cards. Like the attorneys are, everyone is scrambling for these little crumbs, right? Good, I got a little crumb. I don't want a crumb. I want the whole damn pie. Or I'll take most of the pie and then they can have the rest of the crumb. And there's 1,000 crumbs, but there's only one pie. So if you form that relationship, you can start to build on it. And you form a bond of like, they're giving great care. It's not just a business relationship that it looks better on that surgeon where you're like, man, you sent me to Dr. Katz and they really explained this to me, really took the time. Thanks for that referral. Now, maybe I couldn't keep him out of surgery, but that surgeon is stoked. That patient is stoked. And we just educate them. Just educate them. You don't need to sell them anything. They're already at your office because of a problem. Just get them better and explain to them why. And if you can't get them better, explain why this may take a long time, or maybe you can't get them better, but maybe you can prevent them from getting worse. So I can keep going on all day. So I'm not going to sit here and bore you some more. So I hope that that was helpful. And again, you know, log on to Professionally Integrated, use it. Watch the webinars that we did. If there's more questions about, how did he take his notes? There's so many webinars, but the problem is you just have to use it, right? You just have to use it. And if it's a problem, pull it up on your phone on the way to work, push one of the videos of like, okay, I want to learn about facets today. Let me hear about this study. You'll hear my voice for 5 minutes talking about this, and at least you hear it and you're like, I'm going to talk about that one today. Boom, done. So anyway, hope that was beneficial, and I hope that that worked well. And I'm glad that this oops, sorry, I have to push on this. And I hope that, and I'm glad that this webinar format worked better than the last time. So hopefully we're on to the right thing here. So again, use this site. It's right here for you for nothing, right? Like for pennies on the dollar. You don't have to spend 20 grand. Here, use it. So I look forward to it. And again, I keep doing this because it's how we built our practice. I'm going to use it whether you are or not. And I just want to make it available to all of you and, you know, continue to be able to build this. And if you're happy with it, the same way I ask you to tell your patients, please let other docs know. I'm trying to grow this. I'm trying to get more people involved with this. And it's going to be really great for members, as I said, with some of the networking marketing things we have coming up for Professionally Integrated docs. So thank you all so much. I don't think there's any more questions. And again, premium members, you can hit me up anytime and we can talk and go over things one-on-one. So thank you all. I super appreciate y'all, and have fun with this. Like, have fun. Look what we can do. Look at how we can help people. This is what gets me so excited, like what we can do and who we can affect, right? This new doc that just sent in, he's like, oh my God, I had no idea you guys can do this. It's awesome for him too. And now I'm like, I had no idea that you did this. And it started taking me down this different direction and I'm going to have him on Professionally Integrated. He's just, you'll see. Oops, there's one more thing here. Let me just see. Oh, awesome. Thank you. Said this stuff is priceless. I really appreciate it. I hope you use it. So thank you all so much. And I look forward to talking to you all soon.